on roll, played on sport teams, was pretty good at that, all conference, all state. And once I found opiates and opiates found me, my life changed.
He never thought it would happen to him, a Blytheville baseball star.
The only way I could play would be on pain medication.
Turned addict.
I was doing anywhere from at least 80 to about 400 milligrams a day.
Nick Mostowski injured playing the sport he loved. Doctors put him on oxycodone to help with the pain. But about a month later, when Mostowski's injury healed, doctors took him off the prescription.
Then I went to, I guess they would call the streets. I was buying from local drug dealers, and sometimes I would drive up to 2 or 3 hours in order to get my drugs.
But eventually, prescription painkillers stopped being strong enough.
It doesn't matter what opiate you have access to, you go ahead and get the opiate that gets the feeling.
When doctors stop prescribing prescription painkillers or they become too expensive, addicts turn to a cheaper, easier to access alternative, like heroin.
So I think we're starting to see the first movement of the increase in heroin here in Arkansas that may in 10 years look like the rest of the nation.
Dr. Michael Mancino, the head of the Center for Addiction Services and Treatment at UAMS, says cost plays a big role in the switch to heroin. He says it costs about $40 to $50 for a 30 milligram painkiller pill and $30 for 300 milligrams of heroin.
It's a Bill's tolerance, and I wasn't able to receive the same effect off the amount of money I was spending.
Mancino says some of the blame for opiate addiction lies in the hands of doctors.
I think there's no question that physicians play a role in what we call overprescribing, prescribing doses that are too large, prescribing numbers of pills that are too many, prescribing for too long a period of time, and not picking up on the red flags that indicate a person might be having a problem with an addiction.
The state health department agrees.
The human nature wants to please. And doctors want to please their patients. You're going to keep your patient if you prescribe and give them what they want and help them with their problem.
Although Denise Robertson with the health department says doctors wouldn't have started overprescribing if it weren't for false advertising by drug companies. In the 90s, some manufacturers argued their painkillers were non-addictive.
That convinced the medical community to prescribe them for control, for chronic pain instead of just for pain after surgery or cancer pain or end-of-life treatment.
Arkansas's health department working to combat overprescribing with their prescription monitoring program so doctors can view patients' medicine history.
How many they're getting, how many they've been getting it, how have they been using it, have they been going to a few different doctors.
But Mancino fears as the state controls prescription drug access, heroin abuse will continue to spike.
If the addiction's already there, the patient will find the substance that they need.
Treatment also an issue. Compared to our neighboring states, Mancino says we have a tenth of the doctors who can legally prescribe treatment medication.
Tennessee has over 800 doctors that can prescribe medication to help people with addiction. In Arkansas, we have 65.
But as an addict who survived and recovered, Mostowski wants to grow Arkansas's treatment, now working as an addicts counselor at Qatar Clinic.
I was able to struggle and make it out on the other side, and if I could just help one person, that would, the way I was helped, that would be worth it.
Marielle Mohs, 11 News investigates.